What is the primary characteristic of asthma? A. Irreversible airway obstruction. B. Chronic airway inflammation with reversible obstruction. C. Pulmonary fibrosis. D. Bronchiectasis. The correct answer is B. Asthma is a chronic inflammatory disease with reversible airway obstruction. A patient presents with recurrent wheezing, shortness of breath, and nighttime cough. What is the priority nursing assessment? A. Oxygen saturation and respiratory rate. B. Blood glucose. C. Heart sounds only. D. Urine output. The correct answer is A. Asthma attacks impair oxygenation. Assess respiratory status first. Which of the following is a common trigger for allergic asthma? A. Dust mites. B. Viral infection only. C. Low blood pressure. D. Cold weather exclusively. The correct answer is A. Allergens like dust mites commonly trigger extrinsic asthma. A 10-year-old develops wheezing and coughing after playing outside in spring. Which type of asthma is likely? A. Allergic or extrinsic asthma. B. Exercise-induced asthma. C. Drug-induced asthma. D. Occupational asthma. The correct answer is A. Seasonal pollen triggers allergic asthma, especially in children. A patient experiences sudden shortness of breath and wheezing after taking aspirin. Which type of asthma is suspected? A. Drug-induced asthma. B. Exercise-induced asthma. C. Allergic asthma. D. Occupational asthma. The correct answer is A. Non-steroidal anti-inflammatory drugs like aspirin can trigger asthma in sensitive individuals. Which is a risk factor for developing asthma? A. Obesity. B. Low salt intake. C. Young adulthood only. D. Sedentary lifestyle exclusively. The correct answer is A. Obesity increases risk and severity of asthma. Which long-term medication is used to control chronic asthma? A. Inhaled corticosteroids. B. Short-acting beta-2 agonists. C. For fluids. D. Antibiotics. The correct answer is A. Inhaled corticosteroids reduce airway inflammation and prevent attacks. Which assessment indicates severe asthma attack? A. Cyanosis and inability to speak in full sentences. B. Mild cough. C. Slight wheeze only. D. No symptoms. The correct answer is A. Severe airway obstruction leads to hypoxia and inability to speak. A patient has asthma and is prescribed montelukast. What is the purpose of this medication? A. Leukotriene receptor antagonist to control inflammation. B. Rescue bronchodilator. C. Antibiotic. D. Antihistamine only. The correct answer is A. Montelukast reduces airway inflammation and prevents attacks. A patient presents with status asthmaticus. What is the priority intervention? A. Administer oxygen, nebulized bronchodilator, and intravenous corticosteroids. B. Encourage rest only. C. Give oral non-steroidal anti-inflammatory drugs. D. Monitor without intervention. The correct answer is A. Life-threatening asthma requires immediate aggressive therapy. Which diagnostic test helps identify allergic triggers in asthma? A. Skin prick test. B. Chest X-ray. C. Electrocardiogram. D. Liver function test. The correct answer is A. Skin prick tests detect hypersensitivity to allergens. What is the primary purpose of inhaled corticosteroids in asthma management? A. Reduce airway inflammation and prevent exacerbations. B. Provide immediate relief. C. Kill bacteria. D. Increase mucus secretion. The correct answer is A. Inhaled corticosteroids are long-term controllers that suppress airway inflammation. Which medication class should always be combined with inhaled corticosteroids in moderate to severe asthma? A. Long-acting beta-2 agonists. B. Short-acting beta-2 agonists. C. Antihistamines. D. Antibiotics. The correct answer is A. Long-acting beta-2 agonists enhance bronchodilation but must be combined with inhaled corticosteroids for safety. Which statement is true regarding asthma prevention? A. Avoid triggers, adhere to medications, and monitor peak flow. B. Exercise aggressively without caution. C. Take non-steroidal anti-inflammatory drugs daily. D. Ignore symptoms until severe. The correct answer is A. Preventive strategies reduce risk of exacerbations and improve control. Which factor increases risk of asthma exacerbation? A. Exposure to cigarette smoke. B. Balanced diet. C. Adequate sleep. D. Vaccination. The correct answer is A. Smoke is a major environmental trigger for asthma attacks. A patient asks why influenza vaccination is important for asthma. What is the correct explanation? A. Reduces risk of respiratory infections that can trigger asthma attacks. B. Cures asthma. C. Replaces daily inhalers. D. Prevents exercise-induced asthma. The correct answer is A. Vaccinations help prevent infections that exacerbate asthma symptoms. Which class of asthma drugs is used for immediate relief? A. Short-acting beta-2 agonists. B. Inhaled corticosteroids. C. Leukotriene receptor antagonists. D. Long-acting beta-2 agonists. The correct answer is A. Short-acting beta-2 agonists act quickly to relax bronchial smooth muscle. A patient has asthma triggered by aspirin. Which action is appropriate? A. Avoid aspirin and non-steroidal anti-inflammatory drugs. B. Take daily aspirin. C. Increase short-acting beta-2 agonists dose only. D. Avoid exercise. The correct answer is A. Drug-induced asthma requires avoidance of offending agents. Which nursing position facilitates breathing in asthma? A. High Fowler's position. B. Supine flat. C. Trendelenburg. D. Prone. The correct answer is A. Sitting upright reduces diaphragmatic pressure and improves ventilation. Which immune cells play a major role in asthma inflammation? A. Mast cells, eosinophils, and T lymphocytes. B. Red blood cells. C. Platelets. D. Hepatocytes. The correct answer is A. These cells release mediators causing airway inflammation and bronchospasm.